Hello everyone. Welcome to our channel for Nifty HMS. Nifty HMS is cloud-based patient medical record system. If you have recently purchased Nifty HMS, then you would need some help with setting up the system. So today I will show you how to set up a Nifty HMS once you have purchased it. So let's go through it now. So you might have received an email with the username and password. So this is a login screen where you will enter your username and password. You can also log in through your mobile number where you will enter your mobile number on the mobile or email field, and you will receive one-time password on your mobile using which you can also log in. So right now we'll just go with email and password, regular method of signing up in the system. So let's see how it looks like once you click on login button. So this is how it will look like once you log in as a dashboard. I mean, you will be able to see the infographics, and this is pretty good and interesting way of seeing the whole operation in your system. Now let's see the general settings, which is at the bottom most left. And if you click on general settings at the sub menu, this is where you will land. So here you will enter your hospital's name, which year you started the operation, address of the hospital and official phone number, obviously the country your hospital or clinic is located in. So email is very important because this is the email that's been used to send all the email notification and everything. And so use the email that is professional. That's what we will recommend. We also have localized setting. So it's like you have a date format in US different, then you also have different format in Dubai or South America. Then this is the setting you will use. Change the country as per your need, and you can also change the time zone, like if you are between GMT or UTC. So these are the time zones, I mean, that you can set. This setting administrator doctor is important because sometimes you have a single doctor clinic. This is where you will use this setting. If you have multiple doctors in your hospital, then you don't need to check this box. If you are just single doctor in the clinic, most of the time you are the owner of the clinic. This is where you will use this setting and just check mark this setting. We have different 4 ways of getting the notification. So every time when there is a new appointment or new payment that is happening, this is where you will get, system will send a notification. So patients receive notification on email, on WhatsApp. If they are using mobile app, it's a push notification. If they want to receive notification as a text message, then you will select send SMS notification enable. So these are the settings that is useful to notify the customer on different events. Now let's check the header logo. I mean, so 352 by 75 is the size, and on the laptop the logo will appear. So this is the guidance on the logo. I mean, you want to stick to this logo size, but you are welcome to use a smaller or larger logo. Just keep in mind the proportion that is there in the settings. And you can also have so this is how you upload the logo. Once you upload the logo, the file appears over here and then you select it. The other logo settings, 150 by 150, is for the loading icon screen. Now let's see, I mean, if you are a progressive clinic and if you are providing virtual consulting to patients, this is the setting you will do. So you will set up a Google Meet or Zoom link or something like that. The Google Meet is important because that's free. Zoom is might be paid, so we have the Google Meet enable. I mean, this is the settings that you will do right now, but as a doctor you will have to log in, and then so different doctor might have different video conferencing link. This is just a general setting. So if you want to do virtual consulting, this is the setting you have to tell us in the system. Virtual appointment is yes. So for settings, this is the payment setting. So if you want to accept payment through PayPal, Stripe, or Paytm, Paystack, these are the options that you will select. You can also have the offline payment setting, and the currency is important because depending on your country, I mean, this is the currency that you will select. And once you have selected the currency, you start accepting payment in that particular currency. The 3-step consulting patient payment option is important because when in the Nifty HMS there is a easy way to do appointment where you actually do the time selection. Then you also have the payment option, and then you also have the pre-screening form. So this is three-step consulting option. If you want to accept the payment while the patient is doing the appointment, then you will select this as a yes. If you want to accept the payment in offline mode, like patient books the appointment but they will pay you at the clinic, then you will select no as the option over here. For now, we'll just stick to the no option. These are the invoice settings. So there are prefixes that usually you have. If you want to have prefix like INV invoice, then just keep the setting as it is. But if you want to change it to something more relevant to your hospital, HOS or something like that, then you will change the settings as per that. Same thing with the patient prefix, like we have PID or P121 as a patient ID, then you just select P, or over here we have select PAT ID, so PAT ID, and then the actual number of the patient stars. And these are body vital options. So you might have the blood pressure settings, minimum and maximum. These are important because you might have patient in emergency and you want to monitor it continuously in ICU or in the step up ICU. That is where these settings are important. You might have the blood pressure or blood sugar. These are the settings that you would do. Over here we have respiratory rate, then oxygen level. So minimum and maximum value you can set. If the parameter goes out of range, then doctor receives the notification. That's the whole purpose of having these settings over here. Now let's move on to the profile picture settings. This is important because as a patient or as a nurse, there are different user roles. If you want to allow them to change their profile pictures and things like that, then this is the settings you will keep it enabled. Also, you might want to have the prescription report. So in prescription you might have a signature or your own letterhead. So this is the setting where you enable it or disable it. So we keep this is good for the government compliance because prescription is usually signed and stamped. So you keep it enabled and meet the government compliance. We have the WhatsApp appointment system where where you can actually get the reminder of appointment before 20 minutes or 50 minutes, whatever settings you do over here. That's before the reminder you will have. Same way with the vaccination. So if you are a veterinarian or if you are a pediatrician, this is important because you might have the vaccine schedule. We have different template settings. So means that if you are ophthalmologist, then you might want to assess patient left eye or right eye. If you are dentist, then you might have upper jaw and lower jaw teeth assessment things. So depending on specialization, you might have different assessment needs. So Nifty HMS allows you to do the patient assessment depending on your practice. So this is where over here in the system, I mean, you will see there are two, general practice and veterinarians, but there are multiple options over here. So depending on your specialization, you can select the assessment template. Database header settings, this is technical, but this is something like when you have like more like Excel sheet where you have the table headers, this is the same thing. WhatsApp settings, depending on the purchase plan that you have purchased. If the plan comes with WhatsApp enable, and this is the setting that is important for you. I mean, using these settings, if it is enabled, the WhatsApp board will work for you and the patient can book appointment from WhatsApp. Administrator is doctor is the same thing that we have covered earlier. So thanks for watching the video and we hope you like the video. Please subscribe to our channel and get tuned to receive more knowledgeable series like this. Thanks for your time.